Yeah. So, now I'm going to play the audio.
Occupational taking that is not getting to the root of the problem.
Any trouble with your bowels? I know that you're taking regular laxatives, but is...
Oh, have you had this problem before?
Question 27.
Then they told me I developed diabetes too. That was a bit of a surprise, to tell you the truth. I really hadn't seen that.
You'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a palliative care nurse talking to an elderly patient. Now read the question.
So you've had some changes in your diet. Is anything a problem for you there?
I might be losing a bit of weight because I don't like eating much.
Oh, does that trouble you?
No, I just don't want to eat a lot.
Any trouble with your bowels? I know that you're taking regular laxatives, but is that an issue for you?
Oh, I've had a bit of trouble with constipation over the years. I've taken pills on and off. I've taken something now, actually. But I still feel a bit bloated, a bit crampy.
So it's bothersome?
Yeah, it's not what you'd call slight.
Well, I think we need to have a look at you, maybe make some adjustments to what you're taking, especially since you're getting that bloating.
That'd be good.
Question 26. You hear a pharmacist talking to a customer who is in...
Okay. You heard the audio. Now question 25. Yes. 7, 6, 5, 4, 3, 2, 1. Submit. Submit your answer, please. Yeah. War one-sided, huh? War one-sided. Wow, that's wonderful. Now let us see this one very carefully. Okay, we'll see this one, how it matches. Right, that's good, really good. Okay, now first let us check the answer. Let us check the answer. Yeah, on this. Yeah, answer script, answer key. So answer key is here. Yeah, question number 25. Question number 25. Part B. Question number 25. Part B. Answer is here. 25. Yes. 25 answer is C. Answer to question number 25 is C. Yes, update your scores 1 by 1 or 0 by 1. You know our system. Come on. You know our system. Activate. This is a group class. I cannot call you personally. This is one-way lecture. Do it or leave it. Okay. All of you send direct to everyone. Don't send me personally. Okay. Don't send me personally. Send in the group. It's okay. Right? All of you send in the group. Thank you very much. Listen to me. Yes. Wow, that's really wonderful. Dr. Wasi. Dr. Wasi. Dr. Wasi. Yes. Then we have one doctor here. Yeah, that's fine. Dr. Wasi, today I'm inviting you to share your message to the class.
Yes, tell
How
me,
are
sir.
our sessions beneficial? You have joined with our classes. You are somewhere in the Middle East and you have joined our classes maybe 1 week back, but you are attending the session after heavy duty, and so are many other students. So you are a doctor. So you are a doctor, is a role model to all the people in the medical professionals. So your word may be helpful for others. So I want you to speak your voice. How beneficial are these sessions for you?
Yes, thank you. First of all, thank you regarding to give me chance to attend your course. It is really very beneficial because this is my second time I'm going to exam, going to give the exam in 16th of December. Last time, I gave in August. So it is very disappointing to me about listening and reading because I got around 300 marks around that. Because a lot of mistake I was done because I don't know at that time, but I was not practice at all. Just some online some practice and they go to exam directly. So when I joined the courses, then I learned a lot of things, how to approach, how to read, how to write. Everything is there. Still, I'm learning a lot of things. Every day I learn at least few things that is very good for me actually. And where I do the mistakes, I learned from the sir. Really, sir, it is very helpful for me. And especially, I told a lot of my colleague about your course, sir, because a lot of things I don't know exactly. Because I write in the listening actually in my exam. In capital initial, like any fill in the blanks, I don't think these all are small. And lot of space like heartburn. Heart is separate, burn is separate. So it is one word actually when I learned in this previous lectures. So I really appreciate you, sir, because I learned a lot of things. I have no words to tell me about these courses and how beauty of this course is actually. Thank you very much, sir.
Yeah, thank you very much. Actually, I charge doctors more than nurses. He knows how much he has paid. Doctors I charge more than nurses because doctors are getting good amount of salary, and doctors, they don't say anything. Yeah, I charge them more, and nurses I give benefit because they are paid less than doctors comparatively. So I try to bless the nurses as far as possible. Okay, so that's clear. He joined only for reading and listening. Okay, and he is very obedient. Whenever I give links, he'll come and attend. And you see the way how he spoke also. That's the height of his obedience. He's a doctor, no doubt, but he's learning. He has to learn. Unless and until you are obedient, you cannot learn anything. You may be a doctor, you may be a professor, you may be prime minister of a country. That's different. But unless and until you are ready to learn, you are obedient to learn, you cannot learn anything. Even I, same thing. So that's it. You have seen why I made doctor speak is because I want you to know, everyone, those who are watching on the YouTube, the students who are here, they all know me. They are coming through reference. They respect me very much. But those who are on the YouTube watching this program, this message is for you, because a doctor is talking to you about, yesterday I have seen some doctors from some country, and they were asking me, sir, where is your, give me your opinion, sorry, what, a student's voice or something like that. I said, I am taking so many classes, why some reference? But they said, sir, we'll feel comfortable. So many people are giving many messages or testimonials like this. Okay, I said that I will not give you admission. I told I will not give you admission. So, because I don't give admission until and unless the candidate is obedient. Because see, these are very important techniques. There are very important techniques. Now we should understand this question. I'm going to explain this question now. You should be ready to listen. Now I got the answer correct. So what? You got the answer correct. So what? You ate fish today. What about tomorrow? What about day after tomorrow? What about 1 month afterwards? Are you ready to earn your livelihood every day? Will you get every question right? I got all the students got C. Correct, sir. Why are you explaining still? This will help you in the next question. This is going to help you in the next question. Yes. My style is totally different. Once again, I'm telling you. Okay. Now here is the listening script. There is nobody will show you this listening script. No one. Okay. But I have to show you because you are very special for me. Yeah. Here it is. Question number 25. This is question number 25. This is question number 25. Yeah. Now what I'm going to do is, I'm going to bring this one and that one together. This one and that one together. I'll bring you this one and that one both together. Yes, let us see how I'm going to bring it for you. Edit. Yeah. So this is the script. This is the script. I'm going to present you here. Okay. Yeah. Yeah. Is that clear? Is that clear? Type yes or no, please. Is that, are you able to see it? I need at least one or two. Yeah. Fine. Yeah, 4, 5. Yes, thank you so much. That's really fine. What we can do is, I can make one more option for you here. Okay. Yeah, this we can make a little smaller. I think it will be better now. Yeah, that would be better. Yes. Now we have these two things. Now that's very clear for you. Very clear. Now let us see. Now, what is the patient most concerned about? Yes, ready. Now let us see here. I'm going to show you. Now, let me tell you one thing here. What is the patient more concerned about? So who is bothered? Patient. The problem is with the patient, not with the doctor, or not with a nurse. Okay. The problem is with the doctor. So, nurse. Now, female. So you have had some changes in your diet. Is there a problem for you there? So this male nurse, we don't need this. Does that trouble you? We don't need this. Any trouble with your bowels? We don't need this. So it's bothersome. We don't need this. Well, I think we need to look at you, maybe make some adjustments. We don't need this. Try to understand the elimination technique. What is our problem of concern? What is our problem of concern is the patient. What is the patient's concern, not the nurse's concern? Yeah. %50 is eliminated. Male voice and female voice. Who you think? Yeah, I will be asking you some questions now. I'll be asking you some questions now. Forget about this right hand side. I'm closing it. Forget about the right hand side now. Yeah. Now, I wantedly closed it. Now let us see here. Now, according to the point, you know that patient is important or nurse is important. You tell me now. Who is important now? Whose voice is important? Who will give the answer? Nurse will give the answer or patient will give the answer? What is the patient most concerned about? Come on, write down the answer. Patient or nurse? Active. A patient is concerned. Now, most, the word most means 0% or 25% or 50% or 75% or 100%. 0 to 25, 25 to 50, 50 to 75, 75 to 100. Now you just give. Most means what? Come on, write down your answer. Most. Most. Okay. So that is the answer. Concerned. What are the synonyms of the word concerned? Come on, tell me. What are the synonyms of the word concerned? Synonyms. Come write down. Write down. Synonyms of the word concern. Write down, all of you. Problem, worry, difficulty, issue, anxious. Okay. problematic, troubling, bothering. Very good. Write down. Next one, about. About means regarding, concerning, related to. Write down the synonyms. About means concerned, related to, regarding, about. About means, yeah. You can write down these words in the chat box. Next one. Now I am showing you here. Now here, the words much, more, most. What are the words related to the measurement? Measurement. Can you write down, please? What are the words here? I might be losing a bit of weight because I don't like eating much. What are the words? Related words of measurement. Yes. What are the words? Much, more, most. Concerned about what? Yes, please. Yeah. Come on, come on, come on. Yeah, I'm coming there now. Get ready. Yes. The words here are, I might be losing a bit of weight. A bit of weight. A bit of. A bit of. Means some. Not much. Some. Not much. Some. Not much. I don't like eating much. I don't like eating much. I don't like eating much. Eating much. I might be losing a bit of weight because I don't eat too much. Yeah. So much. You can see here much. She doesn't like eating much. Eating much, not concerned much, but eating much. This is not related to concerned. She doesn't like eating much. But how much she doesn't like? A little, not like. Okay. I don't like a lot. I don't like much. I don't like eating much. Means too much of food she doesn't want to eat. But doesn't like much is not given. I just don't want to eat a lot. I just don't want to eat a lot. Okay. Just don't want to eat a lot. Yeah. Next one. I have had a bit of trouble. A bit of trouble. A bit of. A bit of. A bit of. Trouble with constipation. I have had a bit of trouble with constipation over the years. Try to understand this. A bit of. I have taken pills on and off. I have taken something now actually, but I still feel a bit bloated, you know, a bit crampy. A bit of, a bit of. So this is also a bit of, this is also a bit of. Yeah. Yeah. It's not what you have called slight. It's not what you would call slight. Not slight. Not slight. What is the opposite of slight? Not slight. Not short means what? Not short means what? Come on. Not short means what? Write down the answer. Not short. Not short. Not short. You have to remember these things. Not short means what? Not short means what? Tall. Not short means tall. Okay. Not thin means what? Not thin means what? Not thin means thick. Okay. Not thin means fat. Not thin means thick. Yeah, good. Okay. Then next one. Not ever. Not correct. Sorry. Not correct means what? Not correct means what? Not correct means what? Not correct means, yeah, that is a synonym, but not correct means incorrect, means wrong, false. Okay, wrong, false, incorrect, not correct, incorrect, false, true, right, wrong. These are synonyms you have to remember. Not correct, opposite is incorrect. Okay, not correct. Okay, correct, not correct, incorrect. Correct, incorrect. So not correct means incorrect. Okay, not correct means incorrect. Then false. False. The opposite is true. Not false means true. Next one, right. Right. Right means wrong. Not right means wrong. Not wrong means right. Not true means false. Not false means true. Huh? That's it. All these are synonyms you should remember. For every word, one synonym will be there. For every word, one synonym is there. Don't miss these things. Whatever I'm telling you, your mind should be sharp enough. Not slight, not low, not little, not a bit of, not a bit of. Okay, not mild. Not mild means intense. Intense means much. Okay. Any word he may tell. Yeah, so it's bothersome. Yeah, it's bothersome. It's not what you would call slight. It's not simple. That means this is too much. This is not ordinary. That means this is super. Special problem. Try to understand. This is not what you call slide. You cannot call this a slide. This is too much. Now you understand. What is that? What is that? What is that? I have had a bit of trouble with constipation over the years. Okay. I have taken pills on and off. I have taken something now actually, but still I feel bloated. I have taken the pills. I take the medications now also, but still I feel a bit bloated. You know, I'm a bit crampy. Constipation. Constipation. Any trouble with your bowels? Okay. Is it the problem with her weight? Is it her problem with the weight? Did she speak anything about weight? Say yes or no. Did she speak anything regarding weight there? That's it. Fine. Okay. I might be losing a bit of weight because I don't eat much. I might be losing a bit of weight because I don't like eating much. A change in her weight? Is she concerned about it? I might losing a bit of weight. It's okay. But worried the most, a bit of weight, what is the problem? How can you say no? She talked about it. How can you say no like that? All of you said no. She talked about her weight. See in the first part. Now tell me, did she talk about weight? Now tell me, give me the right answer now. Respond. You said no. She talked about weight. I asked, did she talk about weight? You said no, all of you. Okay. Yes, she talked about, I might be losing a bit of weight because I don't like eating much. But she's telling there's a bit of her, a bit of weight, not too much weight, a bit of weight. So that's definitely not too much. A bit of weight she is going to lose, that doesn't make too much problem. Okay. So not too much concern. Yes. Now next one, her new treatment regimen. Her new treatment regimen. Now what about that? New treatment regimen. What is the new treatment regimen? You see there. Any trouble with your bowels? I know that you are taking regular laxatives, but is that an issue for you? Is that an issue for you? Yes, she talked about that. New treatment regimen. I have had a bit of trouble with constipation over the years. That is regarding laxatives, treatment. She talked about it. But again, what? A bit of means very less. Very less. Does that trouble you? No, that does not a trouble. See here. Does that trouble you what? Diet. Does that trouble you? No. See here, there is another point. No. Does that trouble you? No. It's not a problem. It's not a problem. It's not a problem. See here. Problem. Trouble. Issue. Any trouble. Issue. See, all the words will come. All the words will come. All the words will come again and again. Bother. What all words you have written, they will come in a different style. Bother. See? Problem, trouble, issue, bother, every word has come there. Huh? So it's bothersome. So it's bothersome. Yeah. Yeah. It's bothersome. It's bothersome. What's bothersome? I have taken something now actually. What? Pills. So is that a problem with the medication? Is the problem with the treatment? But I still feel a bit bloated. Constipation. See that? I have taken medication. But I still feel a bit bloated. You know, a bit crampy. It's about bowels. Just see there. Yeah. So, question number 25. The answer is a C. Some abdominal discomfort. Did he tell anything about abdomen, the word? No. He explained everything. He explained everything. But did he use the word abdomen? But the thing is related. Okay. I have had a bit of trouble with constipation over the years. I have taken something now actually, but I still feel a bit bloated. You know, a bit crampy. See that one there. Is that because of medication? Is that because of change in her weight? Or is that abdominal discomfort? Now, abdominal discomfort. How do you know that this is, okay, you gave the answer what? All of you have written C. All of you have written the answer C there. 1, 2, 3, 4, 5, 6, 7. Okay, you have written the answer C. Okay. Now tell me, How do you guess the relation? The relation is much is equal to not slight. Is the relation. Much is equal to not slight. Slight means less. Not slight is equal to not less. That means more, much, most. That is the relation now. Then what about abdominal discomfort? How do you know this word? What? Yeah. Yes, bloated. Bloated. And what else? What is the other word? What is the other word? One more word is there. Constipation. Very good. Another word is there. Crampy. Bloated, constipation, crampy. 3 words are there. Okay. 3 words are there. Fine. So I have a bit of trouble with constipation now. Okay, I know that you are taking regular laxatives, but is that an issue for you? I have a bit of trouble with constipation over the years. I have taken pills on and off. I have taken something now actually, but that is not the problem. That is not the problem. But then there comes the problem. I still feel a bit bloated. Problem is not with the medication. Problem is not with the treatment. Problem is with something else. But you are very good. You are attending very nicely. You are staying there for 1 hour. You are studying. You are listening to me, everything. But means there comes the problem. But try to understand the but. But means till now it is less problematic. But now it is going to be more problematic. But is showing the 2 different sides. But is the pointer. No problem and problem. Why he is telling but? Now I told you just now. But is showing you the contrast. But is showing the contrast. It is showing you something different, directing to something, pointing, directing, orientation to something different. But means something different. You are hardworking, you are spending too much time, you are listening to me, you are attending the lecture, you are staying here for 1 hour and you are listening everything. But so till now is normal, but is something exceptional. You are not doing this practice in your personal tests. With me, you are doing now. Afterwards, you are not taking a test and doing like this. So there is the problem. That means personal practice is the problem. Personal practice is the problem. You understand? When you are saying but, that means the totally different point is going to be projected. But means there is a problem. But means there is a problem. Earlier there are problems. Earlier there are problems. That means there is no problem. Earlier there are no problems means there is a problem. That is the contrast. He did not study, he did not work hard, he did not do any preparation, he did not spend time. But all negatives. That means the other one is positive. He passed the exam. How come? Try to understand. But contrast the things. So be careful with but. What are the other words equal to but? Come on, tell me. Write down. What are the other words similar to but? Come on. Can you write? Can you mention? Yeah, however. Come on, give some other words. However is already written. Anybody else? Yeah, you can write. All of you can write however. Other than, although, yeah, right? Although, though, although, even though. Nevertheless, okay. However, okay. Yet, correct. Otherwise, correct. Okay, two more words are there, very important. Yeah, still, that's also right. In spite of, not in spite of. There are three words. Manjula, you made a mistake. In spite of, three words. You made two mistakes actually. You made two mistakes. Ifat, you also made one mistake. In separately, spite separately, off separately. Instead is different thing. Sorry, Sajida. Instead is totally different thing. Instead of means in that place. Instead of him, I went. It's not opposite. In the place of, that's the meaning. Okay. In spite of. Yeah. In spite of, despite, another word. Yeah. Kiran, very good. Despite, very good. So these are all the words. So you have to remember that. So now he said not slight. Not slight means not slight. Slight. What is the meaning of slight? Means very less. I have slight pain. Slight pain means less than 25%. That means 0 to 2 scale. Not 0, 1, 2, 3 is slight pain on the rate. 0 to 10. 1, 2, 3 is slight pain. 4, 5, 6, 7 is moderate pain. 8, 9, 10 is the most pain. You have to understand that. Okay. Slight means a little bit. First one a bit of, middle he said a bit of, lastly he said not slight. That means not a bit of. That means too much. Not little means more. Try to understand how you have to analyze this question. Yeah. Many people think why sir is giving too much of explanation. Yeah, one explanation is equal to, you can do hundreds of tests like this. Hundreds of tests you can do like this. Okay. Yes. So concerned, most concerned, most concerned. He always talked about the opposite words there. See. Yeah. Most. Not a bit of. It's a bit of. Opposite. This is not right. And here most. Bit of. But here most means a slight. Okay. But here he's telling I might be losing a bit of. Not a bit. Too much means the answer. Okay. I've had a bit of trouble. Too much trouble means answer. And here not slight means too much. So if you see very carefully, A is a problem, B is a problem, C is not little. A is little, B is little, C is not little. Not little means too much. Extreme. Okay, it is bothering me extremely. Not slight, but extreme problem. Extreme means most. I'm giving you different words for this one. Okay. I'm giving you all the different options here. Concerned. Concerned means problem. Concerned means, okay, one second. I'll help you a little bit more. I'll take a thinner line. Yes, sir, this is a black line. And then a little thinner line. Yeah. Most means a bit of. No, this is wrong. Most means a bit of. No, not right. Most means not slight. This is right. This is right. Because not slight. Not a bit of. Not a bit of. Not slight. Means too much. Means not little. It's too much. Here not is not there. Not a bit of means it will be right. Here not a bit of means it will be right. Okay. No, it's not a problem. That's the trouble, you know. So this is not a problem. This is not a problem. This problem is not a much serious problem. Does that trouble you? No. Okay. Doesn't trouble me. It's a problem, but it still doesn't trouble me. It's slight. Okay, because only a bit of weight, no problem. A bit of constipation. I have had a bit of constipation. Okay, here. Laxatives. He's talking about laxatives. Any trouble with your bowels? I know that you are taking, okay, regular laxatives, but is that an issue for you? Okay, I have a bit of trouble with constipation. Constipation also a bit of trouble. Okay, constipation also a bit of trouble. Constipation is also a bit of trouble. And she's taking medication. That's also not trouble. But I took the medication now. I still feel a bit bloated, a bit crampy. There you can see. Right? So you have to understand that point there. Okay. So now here he said a bit of. Again he told, see here very carefully. Said a bit bloated, a bit, little, a bit crampy. So it's bothersome. So it's bothersome. Yeah. So now he's telling, yeah. Yes. Now because of this one, there is not slight. Yes, not slight. Yes, it is troubling. Not slight means too much. First of all, he said yes. This here itself you got 100% answer. Then here not slight, you got 200% answer. This is how you are going to analyze the question. If you like the explanation, okay, give your feedback 0 to 100. Anything you can give. You can 0 also, you can give, no problem. Okay, I don't mind. How much you like the explanation, your problem. How much you understood. It's not, you're not giving grading to my explanation. You are giving grading to how much you understood. Okay. Right. If you have not understood, let me know. So where you did not understand, I'll give you a different angle. Totally different angle. Right. If you understood, then we can move forward. No need to learn 100 examples. One example, one solid example is wonderful. Yeah. Okay. Shall we move on to the next question? Shall we move on to the next question? One more question, we'll see. One more question, we'll see. After that, if you're still interested, we'll see another question. Yeah. 1, 2, 3, 4, 5. 5. 6, 7. Yeah, 7 rights I got. So that's enough for me. That's enough for me. Okay. Oh, 1 second. Let me take a picture of this screenshot. Okay. What I'll do is hide floating. 1 second. I'll put this for you. Yeah. Function print screen. Yes. Now I'm going to give you here. Yeah. So you can just download it and save it in your mobile or phone, wherever it is. Okay. And I will put it in the Telegram channel also. Yeah. Yeah. The solid explanation. Yes. Simon needs a cup of tea. Yeah. Yes, that's done and dusted for now. Next, we'll go for, where is this? Clear all drawings. Yeah. Next, we are moving to the next point. Where is this? Yeah. So this is the second question. View, sorry, cancel, view, full screen. Yeah. Yes. Go through this question and make your own points. Then afterwards, I will explain you. Then your ideas and my ideas, your thought and my thought, are they going together? That we'll see. Okay, I don't want you to distract. So Telegram link. Okay, I'll send you. I'll send you Telegram link. Ifat Jabin, I'll send you. Yeah. Yes. Go through it for 1 minute. No problem. Think like how I am thinking. Don't think like how you want to think. No, think like how I will think. Step into my shoes and think. Imagine. Thirty seconds more. Yes, fine. Very good. Now let us see. Yeah, I have to go there again. That's why I did not want to distract others. Yeah, Telegram link is here. I should go there, not to share. Okay. So that is the Telegram link. And this is the message link, post link. You can download from here also. Yeah. Okay. Coming to the point. Yes. Now let us see. Before that, I need some volunteer, one volunteer. Okay. Let me see. Ashmita. She's a new student who has joined today. Ashmita, are you comfortable to answer my questions? I'll ask you some questions. If you're comfortable, you say yes. Otherwise, I'll call somebody. Yeah. No. Okay, fine. No problem. Yeah, next. Who else? Yeah, first chance was given to Ashmita, but she said no. So anybody else who wants to answer my questions, which I'm telling you? I'm trying to make you people think like how I'm. At least one person should respond to me. Yes, Pooja Kesri, very good. The bold, very good. That's awesome. Yeah, Pooja Kesri responded earlier, so I'm giving to Pooja Kesri. Answer only up to the point, only up to the point. That's all. One word, or however I ask you based on that one. Too much explanation, no need. Okay. Limited, central point, center, like a shoulder joint, na? One point like that. That's much. Yes, I'm unmuting you. What's the name? Pooja Kesri. Very good. Yeah, Pooja Kesri, you can unmute. Yeah. Yes, now I'm going to ask you, Pooja Kesari, and whatever you say, I will mark here. It is your turn now. Who is speaking and to whom is he speaking? First one, who is speaking?
A pharmacist.
A pharmacist is speaking. Yeah, absolutely right. To whom is he speaking?
With a customer.
A customer. Very good. All right, very good. You hear a pharmacist talking to a customer. Okay. Who is in a customer? He is experiencing what?
Pain.
Pain. Yeah, very good. Only one word like that. That is what we are centering on one problem. That's only one word. That's it. Okay. Right. What is the customer seeking help about? The customer is seeking. Who is seeking? Who is asking for help? Who is asking for help?
The customer.
The customer is asking. So who is important? The customer is important, or what type of help he needs? Who will help? The pharmacist will tell, or the customer will tell?
Customer.
Customer. Yeah. Customer will. The answer you will get in pharmacist words or answers help word. Customer's words.
Customer.
Customer's word. Okay. Help about. About. What are the synonyms of about? Previous question I told.
No.
About.
Related to.
Related to.
Regarding.
Regarding. Come on, somebody help her. Na? Type the word, she will tell. Na? We are an army. If one person is put forward, you have to help them. Come on, write the word, she will tell.
Such is related to.
Related to, regarding, about. What is one more word? One more word.
Help about.
Okay. About, related to, regarding, and one more word. Concerning.
Because of.
Concerning. Concerning, related to, regarding, about. Write down these words, all of you. Help. What are the synonyms for help? What is the synonyms of help?
Help.
Come on, all of you, type.
To assist.
Assist.
Accompany.
Support, aid, assist. Okay. Yes, these are some words. Okay. Now, next one. Seeking. What are the words for seeking? Yeah, guidance also is right. Seeking. Seeking means synonyms what?
Receiving.
Looking. Yeah, others are writing. You just speak them out also, no problem. If you can think, you can think and say.
Speaking. Asking.
Asking.
Seeking.
Finding. Looking for, asking, finding, seeking, requiring, want. So all these things may come. Okay, searching. Seeking means searching. Very good. Perfect word. Seeking means searching. Yeah. Right. Very good. Okay. Now I'm going to ask you some more questions. Those questions are here related to this. Some more questions. Now we are going to the answers. Yeah. Now, Right. What is the main word in this one? An increase in her arthritic pain.
Main word. Arthritic pain.
Arthritis. Already pain we know, no? So that is not important, right? See, pain is
Increase
already
about
here, so it is not important. Okay, now what is the important word in A? An increase in her arthritic pain. What is the most important word?
increase
Increase what?
arthritic.
That's it. Okay. Increase what? Pain. Pain what? Arthritis. You understand now?
Arthritis.
So it is ending in arthritis. Are you able to understand now?
Yes, sir.
If you say increase, then I will say increase what? Then you will say pain. Pain for what? Then you will say arthritis. So ending in what? Now you understand?
Yes.
That is the most important word. Next one. Discomfort due to a bite splint. Yeah. Now tell me.
Discomfort. Bite
Discomfort for what?
is bite spleen.
Bite splint. So bite splint. Okay. Next one. A potential drug interaction. A potential drug interaction. What is the most important word you think? Come on, all of you help her.
Drug
She will take a
interaction.
decision based on your words. This is a hot seat. You have to help her. There's a program called Kaun Banega Crorepati, and I am Amitabh Bachchan. Okay. And she is in the hot seat. I don't know whether you know Kaun Banega Crorepati or not. Yeah. Who wants to be a millionaire? That's it. Indian version. Yeah, come on, tell me now. A potential drug interaction, which is the most important one. One word.
Drug
Only one
interaction.
word. Interaction of what?
Drug.
Now you understand?
Yes.
So he is worried about arthritis, he is worried about the splint, or he is worried about the bite splint, or he is worried about the drug. Is that clear now?
Yes.
Maybe he has three problems. He has three problems. One is arthritis, one is bite splint, one is a drug interaction. All the problems are there, but for which he is asking for help? That you should know. Is that clear now, all of you? If all of you are clear, say yes. So this patient, this customer has problems, three problems. All the three problems may be there. But he is asking for one particular help. And that help is regarding arthritis or bite splint or drug interaction. That you have to see. Yes, we are going to listen to the audio now. Thank you all. Yes, you can mute back.
Okay. Thank you, sir.
Yes, dear.
So you've had some changes in your diet. Is anything a problem for you there?
I might be losing a bit of weight because I don't like eating much.
Oh, does that trouble you?
No, I just don't want to eat a lot.
Any trouble with your bowels? I know that you're taking regular laxatives, but is that an issue for you?
Oh, I've had a bit of trouble with constipation over the years. I've taken pills on and off. I've taken something now, actually. But I still feel a bit bloated, a bit crampy.
So it's bothersome?
Yeah, it's not what you'd call slight.
Well, I think we need to have a look at you, maybe make some adjustments to what you're taking, especially since you're getting that bloating.
That'd be good.
Question 26. You hear a pharmacist talking to a customer who is in pain. Now read the question.
Good morning. Can I help you?
Yes, I've
been in a bit of pain. I've got arthritis, you see, but it's not that, it's my jaw.
Oh, have you had this problem before?
Yes, it flares up when I get anxious and, I'm a bit stressed at the moment. I usually take some paracetamol, but I don't want to take too much because, I'm already taking arthritis medication.
Well, paracetamol is usually well tolerated and can be used with your anti-inflammatories. But you're right. Taking that is not getting to the root of the problem. Have you seen a dentist or a doctor about this?
Yes, I've had a bite splint at one time, but, it never really helped.
Well, I'd recommend seeing someone about it again because this can become a chronic problem.
Okay, you're probably right. Thanks so much.
Question 27. You hear a dietitian.
Yes, 1 second. Question 26. 7, 6, 5, 4, 3, 2, 1, submit. Nine answers so far. Yeah. We have B's 1, 2, 3, 4, and A's 1 and C's also. A, B, C, all answers are there. Okay. Now let us check this out. What is the answer? The answer is 25. Previous one. Twenty-six. 26 is a C. So 26 is C. Twenty-six is C. Yeah. So update scores, please. Update scores, please. Okay. Update scores, please. So 2 students requested me to replay the audio. So just let me. Others can check and confirm.
Good morning. Can I help you?
Yes, I've been in a bit of pain. I've got arthritis, you see, but it's not that, it's my jaw.
Oh, have you had this problem before?
Yes, it flares up when I get anxious and, I'm a bit stressed at the moment. I usually take some paracetamol, but I don't want to take too much because, I'm already taking arthritis medication.
Well, paracetamol is usually well tolerated and can be used with your anti-inflammatories. But you're right. Taking that is not getting to the root of the problem. Have you seen a dentist or a doctor about this?
Yes, I've had a bite splint at one time, but, well, it never really helped.
Well, I'd recommend seeing someone about it again because this can become a chronic problem.
Okay, you're probably right. Thanks so much.
Question 27. You hear a dietitian talking to a patient about a new treatment plan for diabetes. Now read the question.
Okay. Right. Now let us see. Okay, that's not a problem. Okay. Yes. Number 26. Yes. Now you can see here very clearly everything. A pharmacist talking to a customer who is in pain. So talking about pain. Pain for what? So what is the customer seeking help about? Seeking help about help. Seeking help. Help about what? About what? About arthritis, about bite splint, about a drug. Okay. It's very clear to think about this. He's going to the pharmacist. Pharmacist. If he has problem with arthritis, he'll go to okay. You understand what it is? If it is a bite splint, he will go to a dentist. If it is arthritis, he will go to a doctor. If it is a drug guy, he's go to. Why do you want this stupid audio? Tell me. I don't think whether you understand the logic here. Huh? I don't think whether you have understood the logic here. This is all nonsense. That is what I tell you, logic, logic, logic. You are going to a pharmacist. No, you are not foolish. Don't say foolish. Nobody is foolish. Wise. You are only wise. You are not wiser. You are not wisest. That's a different thing. We are not talking about foolish things. We're talking about the wisdom. Wise, wiser, wisest. Now 3 degrees. We don't have any negative things. Only positive things. Wise, wiser, wisest. You're going to a pharmacist for drugs. You're going to a dentist for bite splint. I also have many times. Bite splint, bite, tooth bite, bite splint. He already told dentist. Arthritis. You'll go to arthritis to a doctor or a dentist or a pharmacist. So simple as that. First word is pharmacist and the last word is drug. If he has increased arthritis pain, why will he go to the pharmacist? Normal pain only, you'll go to doctor. Increased pain, then he should go to the person who is treating this, okay, joints, bones, specialist. Normally, if you have arthritis, you'll go to a doctor. If your arthritis increases, you go to a bone specialist. Okay. Normal pain, you'll go to a doctor. If too much pain, then you'll go to a dentist because of teeth problem. Normal pain, you go to a doctor. But discomfort is there, you'll go to a dentist because of the tooth. Specialist. Drug interaction. Drugs related to pharmacist. So try to understand in a different angle. Okay. Now let us see the question. Okay. Till here you will just see the point here, these areas. After this one only you will go to this part. This is the secondary part. When the audio starts playing, you will go here. Now let us see here. Arrow marks. Again, customer is seeking help about what? It is not. So customer is seeking help about. What is the pharmacist telling? No. What is the customer seeking help about? Customer is seeking help. So customer is, the question is based on the customer. The question is based on what is the customer seeking help about. So customer is important. Now I am centering there. So, good morning, can I help you? So pharmacist, no need. Male, all male voice, no need. Forget. Eliminated. Now 1, 2, 3, 4, 5, 6, 7. Out of 8 sentences, 4 sentences are eliminated. That means the pharmacist is not important because the question is not about pharmacist. The question is about the customer. 50% elimination is done. That means you have to focus more on the customer, not on the pharmacist. Why are you listening to everything? Take it lightly. Only the female voice. Okay. You can focus. These are the tricks. These are the techniques. These are the tips. Now let us see. Yeah. Good morning, can I help you? Yes, I have been in a bit of pain. I have got arthritis. I have a bit of pain, a bit of pain, a bit of less, a bit of pain. So for that they will go, he will ask help, a bit of pain, not too much pain. I have a bit of pain. I have got arthritis, you see. But it's not that, not what, not arthritis. Not arthritis, not that, not that. That is not the problem. Okay. That is not the problem. So arthritis is not the problem. Ruled out. Ruled out. He talked about arthritis. She talked about arthritis, but she said, but that's not the problem. The problem is my jaw. So jaw is the problem. See how the progress discussion is going ahead. Jaw is the problem. Jaw is the problem. Try to understand this. Yes. Have you had this problem before? Which problem? Jaw problem. Jaw means what? Tooth, teeth. Yes. It flares up, goes up when I get anxious. It flares up when I get anxious. I'm a bit stressed at the moment. A bit means little stressed. A bit, a bit, a bit. I'm a bit stressed at the moment. Before it was not a problem. At the moment it's a problem. Whenever I get anxious is the problem. I usually take some paracetamol, a bit of paracetamol, some paracetamol. Now paracetamol is what? Joy is a teeth, bite splint or a drug. Paracetamol is drug. Yeah. But I don't want to take it too much because it is a problem. I don't want to take it too much. What paracetamol? Because why? The reason also she is telling, because you know I'm already taking arthritis medication. Arthritis medication I'm taking. Now I'm going to take paracetamol medication. I don't want to take too much paracetamol because I'm worried, because I'm already taking arthritic medication. Why I am worried? Why I don't want to take too much of this medication? Because the reason is I'm already taking arthritis medication, and if I take this medication, maybe there will be some problem. I don't want to take too much. So tell me, what should I do now? Because I don't want to take too much. I don't want to take paracetamol too much. Why? I don't want. Do something. I don't want to take too much of paracetamol. Do something. Because I'm already taking arthritis medication. That medication and this medication is too much for me. I don't want this medication. I want less paracetamol. I don't want paracetamol at all, if possible. Okay. So he's talking about paracetamol and other medication related to arthritis. She's worried that these two medications together may spoil something. The reason is I'm already taking this. That is why I don't want to take this. That means she's afraid of taking paracetamol when she's already taking arthritis medication. That means what will happen? She doesn't want to take this because she's taking this medication. So if I'm taking arthritis medication and if I take paracetamol too much, what will happen? Some interaction will happen. They will maybe interact with one another, because this medication also will go in the body, this medication will also go in the body. The interaction may be there. They will join together to form something else. Maybe some other problem, some other side effect, maybe. Okay. I'm already taking this medication, so why should I take more this medication? Because I'm worried about that. Now let us see. Well, paracetamol is usually well tolerated and can be used with your anti-inflammatories. Okay. But you are right. Taking that is not getting to the root of problem. Have you seen a dentist or a doctor about this? Yes. I had a bite splint at one time, but it never really helped. Well, I'd recommend seeing someone about it again, because this can become a chronic problem. Okay, you're probably right. Thank you so much. So, is she talking about the discomfort due to the bite splint? She did not say that bite splint is discomfortable, but she said that. You understand? That is after that one. Bite splint has come here. That is later part. Problem is here. This is the problem. This is the problem. Here is the problem. And here is the answer for you. Yeah. What is there here? Arthritis is before the problem. Bite splint is also after the problem. And the real problem is one drug with another drug. Drugs are there. So, that is how you go there. Now let us see here. Okay. Now, yes, once again, there you are. Now let us see. Yeah. All of you, out of you, you have seen there. Okay. Some students have given B, some students have given C, some students have given A. Right? Now, let me take you to there once again. So that is 26th answer. 26th answer. You can see here. The answer is C. Okay. Yeah. So, now let us see the points here. I'm showing you the marks. Orientation of the topic. So, arthritis is taking you to before the problem. Bite splint is taking you after the problem. Okay. Too much. Here it is a bit. Here is a bit. Okay. And here is too much. And too much what? I don't want to take it too much. What is that? Paracetamol. Paracetamol is drug. The word drug will not be heard there. Medication is there, paracetamol is there, but the word drug is not there. Two drugs interaction, drug interaction, paracetamol with arthritis medication interaction. Maybe possibility, potential means possibility is there. That's the point. Okay, now my question is, what do you say was the explanation useful? Okay, You can give your answer there. I'm giving you 10 seconds. So that is the point there. Too much. That's why he's asking help. A bit of pain. So that is not the problem. That is not the problem. A bit of pain. And he's saying it's not. It's my job. Yeah, it flares up when it gets anxious. Okay. I had a bite spleen. Bite spleen came in the last. Okay. One time. Last. That's not the problem, because the problem did not, this bite spleen did not arise when he's telling the problem. Okay. So she's thinking about the drug interaction. That's very clear there. Paracetamol with arthritis medication. Function, print, screen. Yeah. So that is the explanation. You can download from there. And I'll also put you in the Telegram channel. Yeah. So 2 questions I have explained. So what you can do is you can go to the questions, you can study the questions in the same pattern. It will be very easy for you. So tomorrow we'll see some more part C questions. Okay. And also reading. So tomorrow morning I'll be explaining part C questions, 2 part C questions in the morning and 2 part C questions in the afternoon. And in the evening, part B. So we have 6 questions. 2 questions we are done now. Tomorrow morning 2 questions. Tomorrow afternoon 2 questions. Then tomorrow evening we'll see part C questions. What do you say? Yeah. Yes. Are you ready for part C sessions tomorrow evening? Morning batch and afternoon batch. 2 sessions in the morning, 2 in the afternoon. And what tomorrow evening will happen day after tomorrow morning. Are you ready for part C sessions tomorrow? Yeah. And provide your feedback. I cannot explain. See, a lot of explanation is there. I cannot explain all the questions to you. 2 questions maximum. Okay, maximum 3 questions. That's it. Yeah. Yeah, please. Simon sir is working hard. Those students who are due to pay the fees, please pay the fees, because Simon sir is working hard for you people. You know that from morning to evening, he'll be working hard. You come and attend the sessions regularly and pay his dues regularly. Some people requested, sir, we'll pay afterwards. So those who promise to keep your promise, because Simon sir will not demand from you. So it is your responsibility. It is your, goodwill gesture to your teacher who is working hard. You have to pay. Okay. All right. Please do that. And because I don't want to ask you again and again, I don't feel like, good to ask, but, situation demands, I may ask you, but without my asking, you have to give your dues. Let's remember that. Okay. Please. And thank you. Right. So, provide your valuable feedback regarding today's session. Valuable feedback, please. Yeah, 1 or 2 sentences. You can give your valuable feedback before you leave. And thank you very much. Yeah. So let me ask, yeah, Josephine Mary. Are you available? Are you comfortable, Josephine Mary? If you are comfortable, you can unmute and you can speak a few words, how you like the session or you did not like the session or whatever it is. Okay, Josephine Mary, if you are available, I'm unmuting everyone. You can just unmute. Okay, if you cannot unmute, you can just message me. If you are working or doing something, you can message me. Yeah. Then Muhammad. Yeah. Muhammad. Yeah. Muhammad.
Yes,
Yeah,
sir.
I can understand.
Yes, sir.
Yes, Muhammad. Can you share your experience? Where are you from, Muhammad?
I am from India. Now I am staying in Saudi Arabia.
Muhammad from this is yeah. Tell me, share me about yourself, Muhammad.
I am
Your
Mohammed Saeed.
profession, where you are from.
I am doctor. I am from Gujarat, Vadodara.
You are the doctor who registered, right?
Yeah.
With my course, right?
Yes, sir.
I was thinking this person is regularly attending. Very good. Yeah, share your experience, Dr. Muhammad.
Yes, sir. It's truly amazing. I was before thinking that I know everything about this reading and this, but really your explanation is really nice.
Yeah, share your experience. How different is my lectures with some other lectures which you might have attended?
No, it's really so nice, and you have good patience and repetitions, everything. I really appreciate. I like it. That's why I am attending regularly.
Okay, there are many doctors who want to study. Yesterday also they called me, they asked me. So I told you in the beginning itself, how do you, okay, if there is a chance and those doctors asked you, okay, for example, I am a doctor and I want to join in an OET, means maybe you will recommend or not. Why you recommend? What are the good qualities of our sessions? Can you please share?
I will highly recommend your sessions because it will be enlighten you the tips and tricks, what is important. Because you will answer, sometimes you are thinking this is the correct answer, but always it is not the correct answer. There's some trick is there. So this is very important. Also, you are very calm and patient. So I would appreciate this things also.
Yeah, that's very nice. Thank you very much. And all of you can give one or two sentences and you can just wind up. That's the end of the session. Have a nice day.
Thank you very much, sir.
Yeah, anybody wants to talk, you can say. Sajida Tabassum, if you're comfortable, you can speak one or two words.
Hello. Yes, sir. Good evening, sir. Good evening, everyone.
Yeah, you can share your experience, how you feel.
It's a wonderful experience today, especially last question. It's very, I just, before I give an answer, just like a lottery system. Nah? Then after your explanation, it's open out my mind and wonderful that one.
Yeah, thank you
Day
very
by
much.
day, my reading is improving.
Wow, that's really wonderful. That sounds very great. Yes,
Thanks,
thank you
sir.
very much.
Thank you. Thank you for your zealous behavior.
Yes, thank you. Ifat Jabin, can you introduce, if you're comfortable, you can introduce about yourself, Ifat. You can share your...
Yes, sir.
Yes, Ifat Jabin, are you from Pakistan?
Yes, I am. I am from Pakistan. Today I attended your class and it was very excellent. And the explanation, the way you explained the thing, it was fantastic. I really appreciate.
Thank you very much. Thank you very much. So what did you learn today?
Yeah, I learned how deeply we can listen and how we can answer, how we can take up from like likely things, synonyms, and how to apply that.
So what
It
is your
really,
profession?
I am a doctor.
Yeah, you're a doctor. Yes, that's good. That's good. There are many doctors, okay, who are studying with me, Pakistani doctors, Indian doctors, and many other countries. So you have seen now, 2 others are also doctors. I did not remember that they are doctors because their full name is not given. So I missed that. Okay, fine. Nida is able to say doctor. Nida,
Okay, thank you, sir.
no. Nida, you are a doctor, right? Yeah. So many doctors today. Hello, Dr. Nida. Nida, doctor. Yeah.
Hi, sir.
Yeah, Nida, you're a
Hi,
doctor,
sir.
right?
Yes, sir. I'm a doctor too.
Oh, I'm
Doctor
sorry.
from
I'm sorry.
Pakistan.
I did not recall. When I start teaching, I forget everything. So many doctors today. Yeah, share your experience. There are some doctors from your place. They were asking me, sir, give me some doctors' recommendations. Maybe I can send this video to them. Yeah, share your experience.
Sir, this was a very fantastic session of listening part B, as it was a very hard part of listening. Many people could not get through it easily, and all the 6 answers, many answers are wrong. Only 1 or 2 are correct in all 6 answers. After this explanation, we will able to answer more correct options, and I am expecting more one writing session, because I'm not oriented about that, and reading sessions
No,
too.
no problem. You were recommended by another doctor, right?
Yes, I was recommended by another my colleague, Dr. Kawar.
Very good, very good, very good. See, this is how recommendations, one by one, they will pass on the information. That's really very good. Yeah. Rajeshwari. Rajeshwari, do you want to share 1 or 2 sentences, please? If you are comfortable.
Yes, sir. Good evening, sir.
Yeah. Good evening, Rajeshwari.
I really impressed your way of explanation, sir. I have attended many classes like in some other training center, but I never had like these explanations they have given to me. And now I'm able to answer correctly because of you on this. Thank you so much.
Yeah. So you came to me expecting something. And are you able to get that particular something?
Yes, sir, definitely.
Yes, that's really good. And here is a little girl, Kiran Kaur. Yeah, Kiran, you're the last one now. Share your experience, Kiran, if you're comfortable. Otherwise, no problem. Because I know your child will be sleeping, you will not talk. I know that one. It's already 10 o'clock. Yeah, 11 o'clock, sorry. 10 o'clock, 11:30. My goodness. That's really wonderful. I forgot the time itself. Yeah, that's good. So there ends the session. Have a nice day. Good night. See you again. Yes. So dear students, this is Peter Simon, Grand Master class from 7 Sentinels. And here I am with you. So if you're really interested, you might be hearing these doctors and nurses testimonials. So you can watch these programs, and if you're interested, you can contact me for regular sessions, because once in a week I'll be providing free sessions. Other than that, regular students only I'll be focusing. So if anybody is interested, you can get back to me and join my classes only if you're serious enough. It's not that you pay your fees and don't attend the sessions. If you're not interested to attend the sessions, better do not join the classes. If you're hardworking, serious, first attempt itself, you want to work hard, okay, listening from 1 year, leaving from another, it's not like that. You should be implementing my suggestions seriously. Then only I can help you. Okay? You have to help yourself so that I can help you. Thank you very much. Have a nice day. Bye-bye.